Welcome. Today I'll be talking about the best treatment for diabetes mellitus. That's actually diet and lifestyle changes. So the first thing I'm going to be talking about is a good diabetic diet and meal planning for diabetic patients. This video is basically for any patient who's diabetic or someone who's taking care of a family member who's diabetic, to give you some tips and some options to do the right choices. So first, with just a good diet and appropriate exercise and lifestyle changes, you can reverse this disease, especially if you are a type 2 diabetic. So I am going to be discussing about some meal planning options that I talk with all of my patients to follow like an appropriate diabetic diet. There are two ways you could do a good diabetic diet. One is like the plate method, and second is counting the carbohydrate method. But if you ask me what's like a general diet for diabetic, it's low sugar, low carbohydrate. If your diabetes is under way out of control, it's absolutely no sugar and low carbohydrate. But you could do this by two ways. One is the plate method, and the second one is counting the carbohydrate method. The plate method is more like a crude method. Like if you're just looking for a quick way to determine what to eat, you can follow that method, and it's pretty simple to follow. I'm just going to show you this plate here, which is like a 9-inch dinner plate, and based on this we recommend that half of the plate, the shaded zone, you just take non-starchy vegetables, and the other half split it into two zones, and one half you have lean protein and the other half you have your starch. So non-starchy vegetables are things like broccoli, beans, mushrooms, asparagus, and green leafy vegetables and salads and things like that. Your lean protein is, if you take non-vegetarian, it's like chicken, turkey, and meat and things like that. For vegetarians, it's any protein, and for the starch portion, it's basically your breads, your pasta, rice, and things like that come in the starch portion. But if you are an uncontrolled diabetic, we recommend taking 3/4 plates of non-starchy vegetables or salads and just using 1/4 portion for lean protein, and to completely avoid carbohydrate rich food if possible. That's for like really uncontrolled diabetes. This, as you can see, is very quick and easy way, and that's something like anyone can follow. It's like a quick mind math, and you can do this method. The other one, counting the carbohydrate method, is a little bit complicated. It requires more work, but if you do it appropriately, you can see really great results as well. So what is this counting the carbohydrate method? Is basically what it means. You're going to count the carbohydrate in every meal that you take, not only your major meals, but your snacks and any drinks, any fruit juice, anything you have. So you're going to count the carbohydrate in 24 hours and try to limit it. So for diabetic patients, it is recommended that you just get 45% of your energy or your caloric need from carbohydrates. And what 45% means is, I'll give you some numbers. So one serving of carbohydrate is like 15 grams, and in diabetic patients, women, it's recommended they stick to 45 to 60 gram of carbohydrate in a day, and for men they stick to 60 to 75 gram of carbohydrates in a day. This is just a rough measurement. It's going to change based on one's individual age, as I said, your sex, your weight, other comorbid conditions that you might have, and also if you're taking like short-acting insulin 3 times a day, then your doctor might give you different counting the carbohydrate numbers or different goals that you need to meet. I'm just giving you some rough guidance to follow. So that is the total amount of carbohydrates that is recommended for diabetic patients. And so what basically in this method you do is like you try to stick below your limit. So if you're a diabetic woman, you try to stick to the 60 gram of carbohydrates a day or even lower. So you calculate carbohydrates in everything, and you might think, oh, carbohydrate is just there in rice or it's just there in bread. No, even fruits contain carbohydrates, yogurts contain, many vegetables like potatoes contain carbohydrates. So it's there in pretty much everything. So you have to be wary of what you eat and make the right choices. So to discuss about this, I want to introduce another topic called glycemic index. What is a glycemic index? It's like, it's basically a number for a food. Each food has like a glycemic index anywhere from 0 to 100. A quick thing is like high is bad. So a food with high glycemic index actually gets digested pretty quickly and you can start feeling hungry really fast. So foods with lower glycemic index are actually preferred even among the carbohydrate food group, because the lower glycemic index one actually lasts longer in your stomach. They make you feel fuller for a longer time. So they are preferred in diabetic patients. To give you some examples of lower glycemic index foods are brown rice has a lower glycemic index when compared to white rice, and similarly yogurt, beans and apples and these kind of things have lower glycemic index when compared to some other higher glycemic foods, and they're preferred in diabetics. And to give you some examples of what a serving of carbohydrate is, like as I said, a serving of carbohydrate is usually considered 15 grams of carbohydrate. So that 15 grams usually you can get it from like half a bowl of cooked oatmeal, one slice of fruit, or like 1/3 cup of cooked rice, or 1/3 cup of cooked pasta. And if you just take 1/4 of a baked potato, or just half a cup of starchy vegetables cooked, or like just taking 4 to 6 crackers, so this is like one serving of carbohydrate and it gives you 15 grams. So if you're a diabetic woman, if you eat any of this, it gives you 15 grams out of your 60 gram diet. So you need to pick and choose your foods. So I did talk to you about some diet options for diabetic patients, and the next thing I'm going to talk about is exercise. So it is recommended that you exercise for at least 30 minutes 5 times a week, and that is kind of the recommended exercise goal. Of course you can do more, that's very well great. Most of my diabetic patients are usually saying, oh, we have arthritis or we have back pain, so we are not able to go on a treadmill, we are not able to walk outside, what can I do? But for those patients, I would recommend do some pool exercises, like swimming pool exercises. So those are a good alternative because they don't put like a big load on your joint, and you're still able to do it with arthritis and back pain. So pick and choose what you're going to do. Have exercise in mind, have this goal 30 minutes 5 times a week, and strive to get it. With all these diet and exercise changes, you will definitely be able to win over this disease. Last but not the least, I just wanted to talk about food labels, because especially when you're doing the counting the carb method of diet planning, I want you to read food labels and read everything before you go grocery shopping, so you know what exactly you're buying. I'm going to use this as an example. So if you take this box, it says this box contains 1 serving of the content, and each serving has 15 grams of carbohydrates, close to 58 milligrams sodium, 0% fat, and it also has like 620 milligram of potassium. So what it basically means is like this has 1 serving. So if you take the whole bottle, you're going to get that 15 gram of carbohydrate, 620 milligram of potassium, and the 58 milligram of sodium. Imagine there is a bigger box and they say the box has 2 servings of a liquid, and they say each serving has 15 gram of carbohydrate or whatever it is. Then you have, if you drink the whole bottle, you have to multiply the 15 into 2, because now you have consumed 2 servings of the food or the drink or whatever. So what I'm trying to say is like usually if you read a food label, they'll say in the box first how many servings are there in the box. They would say like the box contains say like 1 serving or 2 servings or 4 servings. Like if you take a chocolate box, they would say each serving is 3 to 4 chocolates or something like that, and they would say each serving contains what and what, how much carbohydrates, how much electrolytes, how much proteins. So that is important. So it's not like the whole box has that much. So for example, if they say each chocolate, each serving is 3 to 4 chocolates, and they say like each serving has say 15 grams carbohydrate. If you take 1 serving, you get 15 grams, meaning if you take 3 to 4 chocolates, you get 15 grams of carbohydrates. But if you were to eat 8 chocolates, you would get 30 grams. But if you were to just eat 2 chocolates, you're just going to get like half of it, 7.5 gram of carbohydrates. Does that make sense? Because you have to look for how much servings proteins are there in a box, and usually the amount of carbohydrates, electrolytes, proteins and fats are given per serving. So you have to multiply based on how much you're taking to get the appropriate value for the carbohydrates or whatever it may be. So this tip is not only for diabetics, it's also for people with high blood pressure, or if you have some electrolyte abnormalities, you're trying to watch your sodium intake, you're trying to watch your potassium intake. Reading the food label is a very important skill that I think everyone should have, especially if you're really conscious about your health. Thank you.